my bag technique. Now, I do want to say that this is gonna be best case scenario. If I did not have a clean surface to put my stuff in, this is the #1 reason why I wear a backpack. Because if I don't have a clean surface, I can just get what I need and then flip it back and do what I gotta do. You should always have a clean surface to like put your stuff down. If you don't have that, I would clear out a little area. I would just let them know like at your start of care, like, hey, when I come see you, this is what I need cleaned out. Anyways, yada, yada, yada. Let's get going, okay? So the first thing that I do is obviously I look for a clean surface. Tables are usually my go-to, or dressers, depending on where you see the patient. I always start with putting my backpack to my front because that's where I can grab the stuff that I need in order for me to put my backpack down. If I'm not going to put my backpack on a surface, I would just hang it from like a doorknob, a chair if they have like the little hooks. I don't have that in this chair, but for the sake of the video, pretend that I'm hanging my backpack. So the first thing that you want to do is clean your hands. And I'm only gonna do this once. I'm not gonna clean my hands every time I go. I'm just gonna say clean your hands, okay? Hands clean before you do anything with your bag. So I know that I'm going to go into my big compartment and my little compartment. So I'm going to just flap this compartment open. The first compartment that I'm gonna go into is gonna be my small one because that's where I keep my drapes at. I don't have none for this video because I don't wanna waste them. But when you open the zipper, you wanna go ahead and wash your hands again. I always have 2 drapes, 1 clean, 1 dirty. Once I do that, I'm gonna go ahead and wash my hands again because I took something out of my bag, and I'm gonna go ahead and grab me some gloves. Depending on what I'm doing, I will grab multiple gloves. So I'm gonna put that in my clean spot. Then I'm gonna go ahead and close. You always wanna close the compartment that you just did. So again, I'm gonna go ahead and wash my hands, open the compartment, wash my hands, and I'm going to take out my vital sign. So for this specific video, I'm just gonna do a regular visit with just vital signs. So this is my vital sign container. I wanna say that if I'm in a house that I don't have time to clean my equipment, this becomes my dirty that I take with me out of the house. So I don't put this back if I don't have time to clean my things. I hope this is making sense. Anyways, for the sake of this purpose, I do have time to clean my stuff. So I'm going to go ahead and take out everything that I'm gonna need, close it up, wash my hands. And because this did not come in contact with any of the patient's stuff, I can put this right back in there. Go ahead and close this up. I don't have to do anything with this flap just because this is already zipped up. So then I'm gonna go ahead and wash my hands. I'm going to put on my gloves. I'm gonna do my vitals. As I do my vitals, I'm going to put them in the dirty. I use this dirty. Then I'm going to grab my disinfectant wipe. So I'm gonna go ahead and wash my hands, grab my disinfectant wipe, open it up, disinfect everything. When I disinfect everything, I'm gonna put everything back to the clean. And you want to let this air dry for at least 2 minutes. Then this is when I will do other things with the patient. Once the 2 minutes have passed, again, wash my hands, open the zipper, wash my hands, grab my container out, and put my stuff back in. And again, because this does not make contact with the patient, I can put this back in there. Wash my hands. I forgot to zip this, so don't forget to zip it. And then you just zip it, close it. I wash my hands one more time. I open up the front pocket. I wash my hands one more time, grab me a new pair of gloves, and I bunch all this up together and dispose. If I did something wrong, I'm sure you'll let me know. But this is basically how I do it. I always have 2 sections. I always have a plan B, and my plan B is my clear container. That becomes my dirty. I will put everything in there if I don't have time to sanitize, and that never goes back into my backpack until I can sanitize it. What I usually do is I'll go back up to my car, grab another drape, and put everything on that drape, clean it off very well, grab another clean drape, and let it air dry for 2 minutes. Once the 2 minutes have passed, and I've also cleaned the inside and the outside of the container, then I just put everything back in and I'm ready for my next patient. If you have any questions, let me know. Bye.